or others?
Yep. Oh, sorry. I just
Yeah.
got a
You want me to do
notice
it?
that we're recording in progress.
Oh,
Yes.
there we go.
Absolutely. Michael, that would be great.
Okay. Yeah, so we got talking in code here for a moment. With the 31 million, we are working on a brief application that providers would send in. We're hoping to have that ready in July. We'll be reviewing those when they come in, and then hopefully by late summer, be able to get those dollars out, sort of the timetable we're working on. We'll have providers will be attesting to the fact of, what their losses look like, what they're asking for, and then we'll just stretch the 31 million as far as we can across the asks. Providers will be attesting that they're not getting, telling us if they've gotten other relief funds and kind of what the delta is between what their losses were and what those relief funds were and things of that nature. But we're really trying not to make it too complicated and keeping it at a couple pages so that we can get the information in quickly and we can get the dollars out to you quickly.
Michael, I just wanted to emphasize on that grant. It is the legislature dictated terms on about how that grant program will work. And as Michael mentioned, based on losses due to closures of COVID-related closures and that sort of thing. So that was one important piece of element as the legislature dictated in that grant proposal. So we'll just have to convert that, I think, Michael, as you said, in some sort of brief, efficient, effective tool to as a grant application. I think that addresses the one question there about profit. And then Joan had another question about, I think, Joan, you're talking about, again, the 55 million is retro to April. The 17 million is October.
Jason.
Michael, you were breaking up there.
Yeah. I'm sorry, you went silent. Maybe it was on my phone. I thought you went silent for everybody.
Did I?
No, we could hear you. I think it was just, I don't want to blame your audio, Michael, but I'm blaming your audio. I'm blaming your computer connection.
But Michael, we heard you just fine.
We did
for the grant summary, so that was perfect.
Okay, thanks.
And I was just, I think, answering Joan's question. Joan, I think what you're referring to, again, we have to work with the feds. We cannot implement the second piece, which is the 55 million, until October, even though that is effective retroactively to this April. So we've got to work with the feds to get that rate increase approved. We're going to do that in October, and then there'll be some retroactive settlement. Your point being, can or will that money flow sooner? We hope it will, and we might have news from the feds as early as next month to then start planning for that. But I cannot guarantee precise dates. And I can only say we certainly will have it ready for October, and we hope to have that sooner than that. And I realize the criticality of this, but with our federal approvals, we have to. This is really no choice about it. Thanks, Joan. And again, as soon as we know more from our federal partners, we will be sharing that information. And again, hopefully, that will be sooner rather than later, July timeframe. And then I think we'll have to, of course, there might be some process that the managed care plans will have to go through to update their system. So that might be a couple of weeks and that sort of timeline. So again, we'll know more then. All right, and Carrie's making an important point about the grant funding, doing the application process, the grant process. It will not need to be paid back, and again, the budget, the legislative language is somewhat specific about how that should be administered. I think we hit the questions, Melissa. At least
awesome.
As I see in the chat. Happy to.
That's great. Thank you so much, Jason, for being here. That was really, really helpful. Okay, so next up we have Melody Pazzolt, who's going to be talking to us about some housing investments. Welcome, Melody.
Thanks, Melissa. Just doing a sound check to make sure I'm sounding okay.
Yep, great.
Great. So just this last session was really significant for the housing and addressing the homeless crisis. And so I apologize, I don't have any slides detailing this information, but I will put some information in the chat box. So a couple of really key pieces of legislation that increased the resources for the homeless housing community. One is House Bill 1277. So if folks are familiar with the deed recording fees, these fees are real estate transactions, and essentially every time you go and do a deed or apply for a septic tank, there is a fee associated with some of those document recording fees. And so those funds historically have had sunsets. There's been variations over the years in trying to increase those fees. Essentially the base program, the base deed recording fee program, 60% of those funds stayed at the county level, and then 40% of those funds went up to Department of Commerce. And then Commerce then gives them back to the community through the Consolidated Homeless Grant. What has happened this last year, and those fees were in total about $70 per deed recording fee. What has happened this last session is under House Bill 1277 is that it added $100 to that fee. And so that's going to infuse a tremendous amount of resources, estimated $300 million over the next 2 years that can be used to pay for rental assistance for individuals, eviction prevention. And so there's a lot of new resources coming into communities. And so I really highly encourage the behavioral health community to get connected to your local homeless continuum of care, to work closely with your local coordinated entry program, because that's a lot of the new investments in housing resources are going to go through local coordinated entry. The other investments include a $27 million increase to housing and essential needs. Again, another, if individuals have a short-term incapacity, they may be eligible then for a small subsidy to try and help pay for rents. And so that's a combination of a partnership between DSHS and Department of Commerce. There's also some pretty significant investments in building more affordable housing. So in total, about $175 million to the Housing Trust Fund. So the Housing Trust Fund also is managed by the Department of Commerce. And so those are grants to affordable housing builders to build more housing for people. And people with serious mental illness are one of the priority populations for building more affordable housing. There was also $120 million to acquire properties. So it's called the Rapid Acquisition Program. This is a brand new program in the capital side of Department of Commerce to actually provide grants to entities that want to buy maybe a hotel motel or a single family residence and maybe do shared housing. So there's a lot of flexibility and opportunity through the rapid acquisition, this new line item in the capital funding project. A little bit closer to home, the Division of Behavioral Health and Recovery also received some pretty significant investments. So as folks know, we've been operating our housing and recovery through peer services for the last many, many years. This program grew through a proviso. We started with 3 teams. We now have 10 teams. There's a HARPS program in every region in Washington State. The HARPS program was really initially designed to help people transition out of inpatient behavioral health settings. We use peers, certified peer counselors who've been trained as supportive housing specialists in the permanent supportive housing model to try and help people bridge out of those inpatient settings to find housing of their choice. And the HARPS program also has a housing bridge subsidy. So we can generally pay for first and last month's rent and deposits. We also can try and divert people from going into an inpatient setting. Maybe if that person owes back rent and the thought of becoming homeless is exacerbating their mental health or substance use disorder, we could actually pay arrears to try and prevent somebody from going into an inpatient setting. So the HARPS program has been operating for many years. That program manages about $4 million in housing subsidies. This last session, we received 2 additional line items. One is a carryover from the last biennial budget, about $1 million over the 2-year period, specifically for individuals with substance use disorders. And then under the Blake bill, which is Senate Bill 5476, we received another $1 million for housing subsidies. So, so that's essentially additional housing subsidies for the HARPS program, who can work with people with serious mental illness or people with substance use disorders that may be bridging out of inpatient substance use treatment programs or at risk of entering. If you want more information, I will connect you to the HARPS program in your region, and we'll put that link in the chat box. In addition to the investments for the HARPS program, we also received an investment in housing subsidies for the Foundational Community Supports program. So Foundational Community Supports is our supportive housing and supported employment benefit under the 1115 Medicaid Transformation Demonstration Waiver. So supportive housing, FCS has been providing supportive housing, and this line item in the operating budget gives us $3 million a year to for individuals that may be enrolled in Foundational Community supportive housing that have a behavioral health condition. So mental health or substance use are eligible for these new housing subsidies that are going to be available for people enrolled in Foundational Community Supports. Again, I'll put in the chat the link to the FCS program. So in addition to that, we also operate our forensic HARPS program, which is part of the True Blood Settlement Agreement, where we're helping people that may have touched the legal system through our outpatient competency restoration program or our forensic path program, or people that may have touched, intersected with co-responders and in crisis stabilization. So the forensic HARPS program also has housing subsidies, and we have approximately $5.6 million in housing subsidies attached to the forensic HARPS program. And we're currently implementing forensic HARPS in phase 1, which is Spokane, Pierce, and Southwest region. And this next year, we'll be expanding the forensic HARPS program to King County as part of phase 2 of the True Blood Settlement Agreement. If that was not enough, so that's approximately $18 million that the Healthcare Authority is going to be managing in housing subsidies. In addition to that, you know, the majority of those subsidies are transitional kinds of subsidies. They're intended to be sort of short-term bridge subsidies, with the forensic HARPS program being our longest running subsidy program that the Healthcare Authority manages. You're probably saying, but Melody, people oftentimes need longer term housing subsidies. And that's where our partnership with the Department of Commerce and Jeff Spring in the Community Behavioral Health Housing Program comes in, because the CBRA program, Community Behavioral Health Rental Assistance Program, also received an increase this last legislative session. So they went from managing 1.9 million in longer term housing subsidies for people that were enrolled in the HARPS program or Foundational Community Supports, to getting an increased allocation of 9.8 million. So they'll be managing $11.7 million in long-term housing subsidies for people that may be in forensic HARPS our regular HARPS or Foundational Community Supports program. So we now have a lot of new resources to help people obtain and maintain housing. So we have the services, the housing subsidies, and also are working closely with our partners at Commerce around building more affordable housing. And so those are the three legs of the stool so that we can try and put an end to our homeless crisis. So I'm happy to entertain any questions, and I'll put a lot of those links into the chat.
Thank you so much, Melody. That's so exciting that we have all of those housing resources. It looks like we do have quite a few questions in the chat box. And it asks, will there be funding for ongoing staffing houses for seriously mental ill individuals?
So we really, we're charged by the legislature to follow evidence-based and research-based practices. And one of the most effective practices around housing is the permanent supportive housing model. And when we can wrap services around an individual to give them choice in housing, to look at what's that match, where do they want to live, what kind of an environment do they want to live in, and really follow the recipe for the permanent supportive housing model, we know that people are more likely to be successful. And so both the HARPS program, as well as the Forensic HARPS program and our foundational community supports, follow the permanent supportive housing model. And so we're happy to get you connected to the services that we can provide under those programs. Specifically, foundational community supports is a Medicaid reimbursable service. So we can actually use Medicaid to pay for the services to help people obtain and maintain housing.
Great. Thank you. Any other questions? You can write it, you can type it in the chat box. You can also unmute yourself and ask. If you're feeling a little shy, you could raise your hand and then I'll unmute you. All kinds of ways. This is one nice thing about Zoom via instead of GoToWebinar is it's real easy to ask your questions. Okay. Well, then we will, if you think of something later, and thank you, and Melody just put the link for the foundational community supports is in the chat box as well. So check that out. And then I just want to mention these slides will be available on the HCA website as well. And it looks like Jim has his hand raised. Okay, so let's see here. How can we unmute him? Jim, go ahead. Can you unmute yourself? Are you able to do that? Great. Well, what's your question?
Thank you. For Melody, isn't the issue behind the permanent supportive housing not so much the supports and things that are available, but the actual facilities themselves? I mean, Compass Health just opened a large facility with the 60 to 80, I think, studio apartments in Everett. Where are the rest of the permanent supportive housing units? I mean, are there planned elsewhere?
Yeah, absolutely. And that's part of the Housing Trust Fund and the tax credit properties. There's also, in my 20 years that I've been doing behavioral health recovery supports, housing is probably the most complicated, and I'm using air quotes because you can't see me, because it really isn't a system, because you have federal resources like the public housing authorities and HUD, and then you've got state resources like the Housing Trust Fund, and then there's the tax credit program, and there's the Washington Families Fund, and those are basically all of the different systems that have funding to build affordable housing. But you can't just build affordable housing and just go put up a 100-unit apartment building anywhere and anywhere you want. There's often it depends on having this really complex package application. So one of the things that I've learned is that if you want to put in an application for the Housing Trust Fund, you have to commit to having services available, that you have to commit to that population for 50 years. And so to have entities that can build affordable housing, that can develop those relationships and partnerships with the service delivery system, with making sure that there's people still need to pay rent, that housing, that provider, that developer that builds that affordable housing needs to know where they're going to get money in the future to pay for replacing the carpet or painting, replacing an air conditioning unit. And so those operations and maintenance costs are all part of the three legs of the stool that all have to be that go together to apply for the funding streams to build more affordable housing stock. That said, there is some significant investments to build more affordable housing, but we are never going to build our way out of the housing crisis. So we have to also develop relationships with private market landlords. And I also think that it's important that we utilize our Oxford houses, our recovery residences, that we are really giving people choice in housing and really making a match between what kind of environment they need. And so having tools, that's why we need specialists like housing specialists like foundational community supports and HARPs, so that we can really help people navigate all of these different resources and services. And so they would start with a housing assessment. And if that individual wants to live in a scattered site apartment, a private market landlord, then they would help that person navigate the different funding streams to help pay for that apartment. They might work with the landlord mitigation program at Department of Commerce to make sure that the landlord has some coverage if that person were to damage the apartment or not pay rent. So there's a lot of tools in the toolbox, and those are all parts of what we try and train and provide resources for our FCS and HARPS teams to make sure that they are well equipped with all of that, those complicated resources.
Just a quick add to that. I would think the concern, say, by providers wouldn't be so much about the capital investment. It would be about the need for a dedicated, uninterrupted funding stream for the operational expenses.
So that was one of the new investments actually in this year's operating budget in Department of Commerce, was some of the a dedicated stream for operations and maintenance.
That's awesome.
That's great.
Thank you.
Great. Yeah, thank you, Melody. Any other additional questions? Could be about housing, could be about things you've heard on the call, could be things you want to see. Go ahead and raise your hand and unmute yourself. Or type.
This is James.
Yeah. Hi.
Hi. I actually unfortunately had to call in today, but I heard a great list of resources that are going to be entered into the chat. So I was wondering if you could send those links out in the email as well.
Yeah.
Is that possible?
Yeah, we can. What I'll do is I will create a slide in the slide deck and I will put those links in that slide deck.
All right. Thank you.
Yeah. Anything else? Any other questions? Or resources you'd like to see, things you need help with? Doesn't have to be a question. Oh, great question. Is there any upcoming funding for East Snohomish County? Are you talking about the North Sound ACH, or maybe you could expand on kind of what funding for what in East Snohomish County? Housing, maybe? Oh, housing. Melody, are you aware of any funding coming up for housing in East Snohomish County?
Well, again, get in touch with your local homeless continuum of care. So you guys have a fantastic ally in Snohomish County. She, I can picture her and I can't not think of her name, but your county housing coordinator is fantastic, and she would be a great person to connect with. And so I'll see if, but every region has to have a homeless continuum of care. And so I would really encourage the behavioral health community, providers, advocates to get involved in your local homeless continuum of care. They're going to determine a lot of how their local deed reporting fees are going to be spent. And then also, if the community is applying for maybe investments in the capital, generally speaking, your county may be at the table or part of that application for those funds. And so I would really encourage you to get connected to your local homeless continuum of care.
Thank you. I appreciate that.
Melody?
Mm-hmm.
Yes.
Melody, this is Michael. That's a pretty kind of a general title if you're not working in the housing arena. Can we get a little bit more specific on who they would call to find out about that continuum of care? Is it the county human services, or is it a housing authority in the county? Or
generally speaking, it's your local county social service program. That's been my experience. I can certainly send you the link to the coordinated entry sites for every county. And you could potentially start there and ask them where, what their homeless continuum of care looks like. It can be somewhat complicated with some of the rural counties because there's really more of what's called the balance of state. So the balance of state are the rural counties that kind of come together and are one homeless continuum of care. But I will definitely put the coordinated entry link in the chat as well. And that's your sort of your one-stop triage stop for all homeless housing resources that the county or the Department of Commerce essentially manage.
Okay, thank you. There's another question regarding if you know what the percentage of supportive housing will go towards families.
I do not know that. I do know that there is, so the Housing Trust Fund essentially does have a breakdown of what the priorities are. And I will put the link to the Housing Trust Fund and their guidelines. And certainly, and then there's also the Washington Families Fund that also has capital for families, which is a great resource. I would say the main homeless families advocacy organization in Washington State is called Building Changes. And I would also encourage you to get connected with them.
Great, thank you. There is a question, I believe it's going to be for either Sharisa Fatinos or for somebody from DOH or maybe both. It's asking about what's going to happen with the guidance around masks when the state reopens on June 30th. Will we be officially opening and wearing masks?
This is Sharisa. The good news is I've been on vacation for 10 days and cannot answer that question, but maybe Mary Beth can. I've not seen any official guidance or proposed guidance yet.
Yeah. Thanks. Mary Beth, do you have any follow-up to that?
I also don't have any information. We typically don't get it until the press release for the public. So no, nothing's been shared yet.
Okay, great. Okay. And then Mary Beth, this is also for you. Do you have any update on CEUs for SUD providers being provided for, so the actual question says, the last meeting I attended, I asked if we could get training hours for substance use disorder counselors. And I think Mary Beth, you were going to check on that. Do you have any updates on that?
I don't think I had a readout on that question. So no, I'm sorry. I didn't research that. I don't have enough information about the request to know how to pose it to my colleagues, but I'm happy to pursue it if you can get a specific ask, what training and for whom, and I can track that down.
Okay, thank you. All right, let's see here. And there are some links to Housing Trust Fund in here. And if I can figure out how to add my slides in the chat box, then I will do so. If not, then they will be on the HCA website. And you can also reach out to me. I'll put my email in the chat, and I will send them to you directly. That way it works well. Any other questions, comments, things that you want to know more about, or things that have been on your mind? Anything at all?
Melissa, this is Melody.
Yeah.
Just a shameless plug.
Yeah.
That I will put in there. We do have our foundation's newsletter, which is our monthly newsletter about supportive housing and supported employment. And we probably on average do about 6 webinars a month around housing and employment resources, tips, strategies, programs, resources, information. And so I will put the foundation's newsletter link in the chat box, and it just sort of is quite an array of information available around housing and employment. And we often do announce a lot of these new investments like I went over today. And so happy to put that information in the chat too.
Yeah, that'd be great. Thank you, Melody. And thank you, Carrie. That the slides are now in the chat. You can actually just attach a file. It's quite easy. So those are available for you. And then it looks like, thanks, Carrie. We have another question regarding legislation on law enforcement and reform and accountability, and how that's being experienced by behavioral health providers across the state. Anyone want to speak to this? Has this affected any of you that are on this call and want to share your experience about it, or anyone else on the call? This is kind of a fun, open dialogue. So,
yeah, Melissa, this is Michael. We're certainly planning for the Blake bill administration or implementation of all the components. But I also love the fact that this question is going out to the providers. So in listening mode and taking notes.
Great.
Real interested in seeing if you guys are noticing anything.
Great. Thank you. And I think this is not, I don't think this is the Blake bill. They're referring to House Bill 1310.
Oh, got it.
Oh, no.
Yep.
Oh, no. Yeah. So yeah. That's 1310. And then Teresa was clarifying. Yeah. The person who asked the question, Aaron, if you wouldn't mind clarifying, are you referring to the Blake bill of 5476 or House Bill 1310? Oh, okay. Both. Okay. I see. That makes sense. So yes, this is the Blake bill then. Anyone want to chime in? We're taking notes.
This is Lisa with Okanagan Behavioral Health Care. We have had recent interaction with law enforcement since the change as far as what they are able to do. And we are actually going to be having some meetings with our local sheriff's department as well as local police chief this week, I think on Thursday, just trying to figure out how both organizations, law enforcement and behavioral health, are going to try to work together moving forward, understanding that law enforcement's role has changed drastically. Last Thursday, we had or a week ago Thursday, we had an instance where we had a client that was accelerating in our office, and we contacted law enforcement, and they came up, and basically their hands were kind of tied. There wasn't anything that they could really do. And it was the first time we'd really experienced the change. And so it really brought up a lot of questions on both sides. So at least we have law enforcement officials that are willing to work with us to try to figure out, okay, where do we go together from here to make sure everybody stays safe, and we kind of find that middle ground. So more to be revealed, I guess, but at least we've got folks that are willing to work on it.
Yeah. Thank you.
Can I ask a clarifying question? This is Teresa Vatinos from Healthcare Authority. Was the person escalating due to a mental health condition, or was it a substance use disorder condition?
It was a mental health condition.
And did law enforcement feel they weren't able to intervene because they had no tools?
That's a really good question. I wasn't actually a part of the incident, so I think there was just a lot of hesitancy on their side as far as, I think they're trying to figure out what they can and can't do as well. And they were probably, I guess, I'm guessing, erring on the side of caution. Although the gentleman, the client in question was, typically we would call and law enforcement would come in and help us transport that individual to the local emergency department so that we could get them medically cleared and evaluate them. And they weren't willing to do that at that point. So that's kind of where it was left. Fortunately, we were able to de-escalate the situation and get the client evaluated, but there was just a lot of uncertainty on that particular day. So it opened up an avenue for more conversation on both ends.
Thank you.
Great. This is good. Any other people want to share? We do have another question in the chat box from the Salish BHASO that says, I'm hearing from providers in Salish region that there are concerns about Ellie not being able or willing to join crisis workers in conducting outreaches. The Salish BHASO will be gathering more information as this change impacts crisis workers and citizen safety. Yeah, thanks a lot. Oh, there's a hand up. Well, go ahead and unmute yourself. Thanks, Teresa, for letting me know. I didn't see it.
It's gone.
Oh no. Well, I'm sorry. If you had a hand up, just go ahead and unmute yourself. We definitely want to hear your shares and your questions. You can just speak out. You know what? If you accidentally talk over each other, it's not the end of the world. It won't be the first or last meeting that ever happens. And
well, just to clarify, I think that was my hand that was up. But
okay.
I just went ahead and started talking. So
good. Okay, good news. Thank you for doing that. Anything else? Anything you guys want help with? Anything you want to know more about? Anything, you can use this time to connect with each other as well. You can see who's on the call. So if there's somebody on the call you want to connect with, go ahead and do that.
I'll ask a question real quick.
Right.
Just general population here. I'm with Comprehensive Healthcare, and we're looking to try to open up our buildings and such. And we're interested in different aspects of how you can try to manage to keeping clients wearing masks. And at what point, if they start becoming unruly or refusing, do you choose to not provide services? Do you choose to escort them out? If they refuse to go and become violent or destructive, at what points do you call the police, or what are the options?
That's a great
question. What are people considering?
That's a great question. Do you have any insight into that, Teresa?
Do I have any insight? I think a place to start, as you were asking the question, it might be interesting to hear if there are any providers on the call who have thought through this and put some things in place. I don't know that there is a one best answer necessarily. It will kind of depend on, your staffing, your situation, what kind of clients you're seeing. So I'd be curious to hear, if other folks have implemented some policies. One thing that quickly comes to mind, and then I'll be quiet, is I think depending on the rationale or reason why that person isn't able to wear a mask, that would be an opportunity if you're able to conduct a video visit, if they're willing to do that. So I think, looking at options rather than saying, well, we can't take care of you if you're not willing to wear a mask. And that's not what you said, but I think, looking at alternate ways, I'll be curious to hear if there are other folks who've already started to deal with this challenge.
Yeah, that's a great point. Yeah. Anyone want to share out what you've done, or anyone? Go ahead.
Oh, I was just going to, this is Lisa again with OBHC. We have actually worked through that process, and we have a table right as you walk in that kind of blocks entry into our lobby with masks and the sign and all that good stuff. It gives our front desk staff an opportunity to speak with somebody at a safe distance if they aren't wearing a mask, to explain what our requirement is. And then also for the person walking in to basically state why they aren't wearing a mask or why they can't wear a mask. We've got a couple different options. We have a phone that they can take outside and maybe back to their car, and we can talk to them over the phone. We've actually asked people just to step outside, and we've had providers go out there and have a conversation in out in our courtyard away from everybody at a safe distance, to where they can do that if the person doesn't want to put a mask on or can't for any reason. Of course, we always offer telemed services and things like that, but we haven't had too many difficulties with it. We've had, folks coming in without a mask, and we've been able to work with them and still be able to provide services just by having a couple different options that we can offer.
I'm glad to hear all those things. That's a lot of what we've been doing during the lockdowns and stuff. We're trying to plan for opening back up. And as long as the CDC is considering healthcare facilities as needing to maintain social distancing and wearing masks, we're still trying to figure out how can we unlock our doors and not have staff physically at the doors still doing the individual screenings and taking up their time and ability to, because it's just eating a lot of resources for us. Our big buildings got so many openings and doorways and stuff like that that it would take us a lot to manage that. So I'm looking for, when we do start opening up, to be more like normal, but still, if we still have to enforce masks, to somehow do that.
Yeah.
This is Teresa again. Just a thought on that. I've not seen any clear guidance yet, and I suspect that, well, I would hope that as the CDC issues recommendations, they would adapt them to the sort of setting, meaning that a hospital emergency department, in my mind, would have different regulations or guidance than an outpatient healthcare provider. And I think a lot of it will depend on sort of local vaccination rates as well, perhaps, and current activity as far as COVID is in the community. So I think it's going to be complicated to stylize it to each particular place, but the considerations are a bit sticky. So hopefully they'll be able to come up with some broad recommendations that can minimize some of the wear and tear that you're all experiencing on your staff, doing additional jobs to those they do every day.
Yeah. Thanks for saying that.
Hopeful. We're just still waiting to see how it's going to be coming out, but trying to plan ahead.
We are right at time. So any final thoughts?
This is James again.
Yeah.
I got one final thought. It is related to Blake Bill. To Blake. I do believe there is separate meetings that happen around this, but I don't know if you have any additional information regarding the SUD regional administrator and the Recovery Navigator program.
That's a great question.
So this is Michael. I'm sorry. If you're asking about the administrator navigator, the administrator position, we are putting money into the BHASOs to hire that position as close to the 1st of July as possible. We are also working on standards for the Navigator program. And then once we have those standards developed, the BHASOs will be sending in plans to DBHR for the Navigator program. We will then approve those plans, eventually we will approve the plans, hopefully in pretty quick turnaround. And then the BHASOs will start hiring up for the program. So we're talking sort of a summer-long process in terms of get the administrators on quickly, get the Navigator standards set, BHASOs will create the plans, and then we will give them the go ahead to start hiring those positions up, hopefully by September-ish, sometime like that.
Awesome. Thanks.
Great. Thank you.
Yeah, and this is Dr. States. Going back to House Bill 1310, I just have a couple questions. That's a House Bill 1310, at least from the folks I'm talking to that are in law enforcement, that's a, well, maybe we should say a seismic change in their responsibilities. And I'm just kind of wondering, that will probably change 911 responses. So is there two questions? Is there training that will be targeted specifically at 911 operators to help triage? And is there any sort of public PIO type of message that will go out to the public that would ordinarily expect law enforcement to show up if somebody is acting, let's just say, out of control in the neighborhood, but not waving a machine gun yet? And they're expecting a certain response, and that response won't be occurring. So what kind of long range planning is there for the triage and for the public education? Thank you.
Okay, Michael, do you have a response to that, or do you want me to follow up via email after the call? I can do that too.
Yeah, the 1310, I think we should probably follow up with.
Okay.
And I think we're past time anyway, but yeah, I think we probably should follow up with the 1310 questions.
Okay, that sounds great. Well, we are at time. We're 3 minutes over, and I so appreciate you taking this time out of your day to listen and to talk with us and connect with each other. We really appreciate you, and we will be back in 2 weeks on the 29th of June, and that call will focus on behavioral health and COVID-19. Have a great day, everybody.
Thank you.
Thanks. Bye.